Hi, I'm Celeste. I'm a physical therapist assistant. This is Shannon. She is a patient of ours who is wearing what we call the TheraSuit. It's also known as a proprioceptive orthotic. It helps to with postural alignment when a patient is doing therapy. It's the suit itself is used. It's a tool that we use during our therapy. They do functional activities in it, whether it be walking or right now I'm getting a belt on Shannon, and it has loops on it here that is going to
well, let's see. No, they're not.
That's okay. We won't use those. Okay.
Sometimes you put.
Sometimes you have to improvise. What I'm getting ready to do now is hook Shannon up to some bungee cords that is going to allow her to stand unassisted, but it works on her balance. I can have her either stand still in the bungees or have her march in place or sitting on a ball to work on her core. Let's see you march in place, Miss Shannon.
You think that's easy, but I'm due for another intensive, by the way.
There you go.
I'm not kidding.
Oh, that's good. Okay.
Don't ask me to do this without these things on.
Okay. But the suit itself has hooks on it, and we use bands. It has these elastic bands. They're rubber, but they have little knots on them. That's how we attach it to the suit, and it helps to proprioceptively for patients to feel their muscles, and it helps to facilitate some muscles. If a patient is weaker in one area, you can tighten the straps in that area to help with the proprioception and the facilitation.
So the suit basically helps you to use muscles that you aren't normally using on your own?
Your muscles that are weaker, it will help you in a put you in a postural alignment and give you some joint stability to help those weaker muscles work also.
Okay.
Okay?
It assists the weaker muscles and resists the stronger muscles.
There you go. Assist and resist.
Assist and resist.
Okay. Do you
Okay,
want to
and-
get a ball?
Okay.
Okay.
No, I was just gonna tell her that yeah.
Okay, I'm gonna get a
that
ball.
I had a traumatic brain injury, and this was like in, I don't know, but a long time ago, and I went through all kinds of therapies, and this is the therapy that really helped me get my balance back.
Okay.
And the therapist had a lot of fun doing that because they'd stand behind me and in the bungees, like, push me. And see, I can't fall. I have to, if I want to stop myself. And then they taught me how, to put my arms forward. And, if I'm going to fall. And see, this isn't going to let me hit the ground. So they had a lot of fun pushing me around, But that's how I learned to, fall and get my balance. Whereas without things like this, it's not like I could have just been on the floor and they push me over, you know, this is what helped.
So basically, the suit has benefited you more than any other method?
And yes, and I'm not, you know, all of the therapies I went to were wonderful. It's just this went that added extra distance that none of the other ones could.
Mm-hmm.
And it also helped me verbally, because I stuttered and couldn't think of what things were called, and it's amazing how much physically it goes beyond, and then verbally things are starting to come together.
Mm-hmm.
If that makes any sense. And it has deep pressure, and that also really feels good.
Yeah, it helps to kind of, for kids that are maybe kind of hyper,
Uh-huh.
it helps them,
I'm like I said, I'm due for another one.
it helps them to feel more grounded.
Yeah.
There you go. There you go. Okay. So in her sitting on here, she can bounce. And we can slowly just kind of move her around.
And like for patients that say, you know, they lean one way, the suit will say, I normally lean this way. I don't, but say I normally did. These bands on the suit would help these muscles, my oblique muscles, work. It would assist the weaker ones and help to pull me more into the center,
Okay.
into midline.
So we do that. We can do this kind of stuff. Push her backwards, forwards, where she might have to come forward. Come forward. Okay. So that's some of the other things we do. We can do that, working on balance, have them pick up a leg.
And before I couldn't even pick up my legs. Okay.
Okay. All right. Let's have you. Oh, you lost the hook.
Oh. And I tend to break the suit now.
Some other. Sometimes we will have patients work in kneeling, or like in tall kneeling or half kneeling, especially if it's a child. They can work on muscle stability or strengthening of their hip abductors in that position in half kneel, which is this. And we have them playing with toys and things, or reaching up, or and it helps them to fully extend better. So let's see.
Or they'll sit on
They can sit on a bench,
a bench or a.
and we work on sit to stand. Let's see.
Oh, grab the I can't think of what it's called. Long round.
The peanut?
No.
Oh.
There's a red one and a blue one.
Bolster.
Thank you.
Okay.
Brain injury on film. Okay. Now I was just gonna tell her that, you know, on the bolster we can do all sorts of things.
Yeah.
You know, on the bolster or abduction or tall kneeling on the bolster, over the bolster rather.
Now Shannon is very high functioning, as you can see.
Now, yes.
But yeah, but
there was a point.
let's see. Yeah, can you sit from there? Yeah, it allows you to sit, but it's pulling it, huh? Okay.
And
So
that's working my back to try to, you know.
make me sit up.
Yeah.
Okay. So one of the other things that we can work on from here, the bungees are like an extra set of hands for us, because a lot of the kids that we work with are low level. They're not as high functioning as what Shannon is, but and a lot of them we will need to work on sit to stand. So what we'll do is have them lean forward, nose over toes, and then come up. And for some of them, that's very difficult.
Yeah.
Okay,
Some
come back down.
We had a 64-year-old adult who that was very difficult for.
Yeah.
And he ended up really enjoying it, as he complained, but at the end, he was like, oh, that was wonderful.
So let's just go ahead and do that again. Get you up from here. And you adjust your, because you look like you're
Yeah.
All right. The other thing I was gonna say is, we
And
can
doing
maybe
squats
show.
and things like that.
Yeah, we do, squats, just a lot of dynamic balance things. Sometimes I try to get them standing on one foot. I don't know if Shannon can do that. Or on
No.
a balance disc. Do you want to try the balance disc?
Sure, why not?
Okay.
I'm game. Everything helps.
You want the wood one or the blue one?
Doesn't matter.
All right. Well, this will probably be more of a dramatic show of a dramatic. Okay. This is a balance disc. It has a little rounded piece on the bottom.
I'm about to pull your hair away. I was about to grab the ponytail too.
Okay. There you go. Okay.
And this
Alright,
is
you're-
cheating. Yeah, I'm too far that way.
Yeah, I see that. How's that?
Yes. Cheating is holding on to the ropes like I'm doing. Okay. You just have to trust, because it's not going to let me fall, but
Bring it forward, Miss
I'm
Shannon.
trying.
Good. And I'm just kind of rocking her forward because she seems to be having a little trouble. She wants to stay back.
I know, and
There
I'm
you go.
trying. That's what I said. I have a script to do another intensive, but as you can
Yeah,
see,
no trouble
okay.
staying forward. Yeah, I'm
Okay.
tugging it a little bit there. There we go. Okay. Yeah, let's do that. Still in your heels.
I'm trying to get not on my heels. That would be my toes. I had to think of what that was.
Awesome.
Rocking forward. Okay, so that's just some other options of something you can do. Okay, go ahead and step off.
So, in other words, would you say suit therapy would benefit better over the traditional therapy methods?
Well, for some patients, yes. Some people get extreme benefits out of it, and it doesn't take them as long to see the benefits. Some other people, depending on the severity of their diagnosis, it may take a little bit longer for them to actually see a difference.
Okay. All right. Well, thank y'all so much.
Okay,
Bye.
you're welcome.